This is a story of UN hypocrisy, of censorship to cover up corruption.
This was a letter that the United Nations sent to Inner City Press earlier this year, telling it that it was being thrown out of the UN for trying to cover a meeting in the UN press briefing room in January. It was a meeting of the UN's media partner, and Inner City Press wanted to cover it due to connection to the Ng Lap Seng UN bribery scandal. Here's what the president of UNCA said to Inner City Press in the meeting, in a tape that the Department of Public Information, Christina Gallach, reviewed before throwing Inner City Press out.
You are mentally sick. Mentally sick.
On October 11th, Inner City Press asked a UN panel moderated by DPI about the issues raised.
World Mental Health Day will...
Matthew Lee, Inner City Press, on behalf of the Free UN Coalition for Access. Thanks a lot for the briefing. It was from yesterday to today. Glad you made it back. I had some other things, but I want to be sure to ask you this one. I think I heard you speaking about human rights and even stigma, the idea of trying to... So I wanted to ask you a specific example, and what you think the UN should do. In this very room where we're sitting, in fact, where you're sitting, Ambassador Otto, earlier this year, it was said from the podium of somebody wanting to cover a meeting in this room in connection with the corruption scandal, quote, "You're mentally sick." And this is a tape that's been reviewed by DPI and others, and nothing was ever done. They thought this was fine. So I'd like you, particularly WHO, as an expert, do you think this is appropriate? Do you think that that using alleged mental issues as a publicly as a way either to avoid coverage or however it was meant to be used is appropriate? And if not, how can the UN accept it? What should be the UN approach to that? Thank you.
No question about non-acceptance of stigmatization and discrimination of people and using any such labels, especially when it is mental health is just another disease. We don't label people by any other disease, so there is no reason why we should do that. But the reality is such that this is happening. Now, of course, it requires a lot of education. It requires a lot of advocacy. It does require also very clear non-acceptance of any such statements in any fora. So we definitely stand by that. And we are working in many different programs to incorporate, to educate also health workers and the social service providers how to handle those issues. We have to deal with this at a very early ages. Also, this comes from childhood when people start, bullying each other, small kids in different settings, etc. Answer to your question is yes, we are not accepting that. The other question, whether we have any legal means to punish people who may have said it without necessarily meaning or understanding what they are doing, I think it has to do with the long-term education, clarification. Our own personnel, our own staff have to be very well trained to help the not just the health workers but also it has to be broader population education, which is required, and change of the attitude to mental illnesses. This is part of the campaign also for the depression that we are trying to escalate towards the World Health Day.
Sure. Just one quick follow-up. I mean, I understand what you're saying. There can't, especially in the UN, there's no legal sanctions. But I guess I wonder if a department, in this case the Department of Public Information, reviews such a tape and sees such action, and in fact only punishes the person who was the target of the comment, do you think that's appropriate?
Matthew,
it's a question. I'm asking it's a question.
Yeah,
it's my question. It's a press conference about
broader. I think there's a broader question here.
Then you ask the question.
I
should be sitting.
I should, but I don't think it's anything either of our.
You work for DPI?
I do.
Okay, well then. Let me
but
ask
I
the
can't
question.
answer your question because I don't know the answer.
I know. That's why I'm asking them.
But I don't think that's a question that's relevant.
I'm just thinking that perhaps in terms of the sustainable development, if we look at that as a framework for the way we go forward, so goal number 16 is talking about good governance and transparency, and those have to be applicable to the UN, first of all, in terms of the way we do things. And I think this is the way we have to start where we are and move from there. So I would say taking our cue from goal number 16, we should look at them to see whether those labeling or anything that we did are non-transparent, and how do we begin from there, because we have to sort of start walking the talk that we do. Otherwise, we cannot transform the world. And so I think this, if we're talking about the 2030 agenda as a transformation, and we have to begin where we are. So I think this is a relevant question, and we have to start with goal number 16 right here at the UN.
Thank you, Ambassador.
Any other questions? In that case, thank you very much, and thank you.
Thank you. We're just on time.